I am Dr. Uday Prakash. I am an orthopedic surgeon. I am also the director of Uday Omni Hospital in Hyderabad. We are now celebrating our 50 years of existence. My father started this hospital in 1974, and we have been consistently doing world-class orthopedics for the last 50 years. We have now moved on to a new hospital which has 100 beds, and we now specialize in all aspects of orthopedics. My own specialty is joint replacement, complex joint replacement, revision joint replacement, and arthroscopy of the knee, which includes ACL injuries and meniscal injuries. We also specialize in trauma, all fractures, from neck down to the toe. What I'm going to talk about today is knee replacement surgery, because people often ask me, when is a good time to get a knee replacement, doctor? So over the last 10 years, since I've come back to Hyderabad from England, I've noticed that people get knee replacements for even moderate arthritis. I personally feel that knee replacement should be done for advanced arthritis. Arthritis is nothing but wear and tear of the knee joint. There are different types of arthritis. One of the most common arthritis is osteoarthritis, which is simply wear and tear of the knee joint. This happens to almost all adults over time. Some adults, unfortunately, get a very severe arthritis, which can affect their daily activities. This includes sleep at night, getting off a chair, inability to sit on the floor, not being able to walk more than a certain distance, etc. What I feel is when patients have problems with all their daily activities or most of their daily activities, and along with that, they have severe arthritis effect, which basically means bone rubbing on bone inside the knee joint, and the knee joint is bereft or has no cartilage. That's a good time to get a knee replacement done. There are different types of knee replacement depending upon the extent of severe arthritis. We have what we call a partial replacement, which we do very often. I offer partial knee replacement to people who have unicompartmental disease, or only one of the two compartments are affected, and where there is bone-on-bone arthritis. This is a very good operation, and it is suitable for almost 40% of my patients who are undergoing knee replacement. So in partial knee replacement, we essentially resurface just one compartment of the knee and insert a new cushion, which not only corrects the deformity, relieves the pain completely, and in my books and in my opinion, it stops the progress of arthritis. So partial knee replacement is not a temporary knee replacement, it's a permanent knee replacement. In my opinion, almost 90% of people who undergo this wonderful operation will never need second surgery. What partial replacement does is that it preserves most of the knee joint, and the other compartment which is not affected is preserved, and this way the recovery is far quicker and blood loss is less, and the knee joint feels much more natural to the patient. Many of my patients are able to sit on the floor, are able to go up and down the steps easily, and quite a few of them are going back to their sporting lifestyle, which includes golf or badminton or tennis or moderate level of sporting activity, including trekking on mountains, etc. The other type of knee replacement is a full knee replacement or a total knee replacement. And in my opinion, this should be offered to people who have extensive arthritis affecting all the compartments of the knee joint, and they have trouble with everyday activities of daily living, like I mentioned before. A total knee replacement is also a very good operation. However, it takes 2 to 3 weeks longer to recover fully when compared to a partial knee replacement. Ultimately, the results of total knee replacements are very good. The final result really depends upon how skillful the surgeon is and how carefully he has balanced your knee during surgery. By balance, I mean, I can give you an analogy. It is like the wheel alignment of a car. If the wheel is not properly aligned, even in a new car, the car doesn't feel good to drive. It seems to veer to one side. And that's not a good feeling. And similarly, if the knee replacement is not properly balanced, the patient is not very happy with his knee replacement or her knee replacement. What we have noticed, and this is an international study that was done, what people have noticed is that the best results are obtained if they do few knee replacements, i.e. less than 20 a year. The results are not very good. So I think a knee replacement should be done very carefully, skillfully, and then the outcomes are very good. What can you do after knee replacement? Well, pretty much whatever you can do. Well, like I mentioned earlier with partial, many people can get back their former lifestyle and can get back to moderate level of sports like badminton, doubles badminton perhaps, golf, trekking, skiing, etc. These days, many people ask me about robotic knee replacement. This is a new kid on the block. A robot is nothing but a tool which has given us an ability to do this operation even more precisely. I have been doing knee replacements for 20 years, so my results, I feel, are generally very good. However, my expertise in this area, my knowledge of the biomechanics of the knee helps me plan a robotic knee replacement extremely well and down to the last degree. A robot doesn't do the operation itself. We have to feed the data of the patient into the robot, and then the robot will execute that. It essentially, the robot we have will cut the bone in exactly the way we want it to cut, and in exactly the alignment we want it to cut. So what I found with the robotic knee replacements is that I'm getting sub-millimeter accuracy. That means I can personalize the alignment of the knee, which is natural to the patient. So it's like saying I can give the alignment back what the patient had, say, 25 years ago when he or she was a young person. So that is the advantage of the robot, although it's not a necessary tool to have for a good knee replacement surgeon. But I feel a robot gives me far more accuracy, far more precision, and I feel that this also will give the patient an extra longevity of the implant. So I feel that this is a good tool that we have acquired, and this will help patients in the long run. At this hospital, we have also been doing very, very complex surgery. For example, when people have infections after knee replacements, we do an operation called a revision knee replacement. Or if people have had previous trauma to the bone and they have extreme deformity, we're able to do a knee replacement after correction of the deformity. So the question I was asked was, what kind of complex cases do you do? So basically, I can divide this into complex primary and complex revision knee replacement. So knee replacement, when people have already had knee replacement surgery and they are not happy with it because of certain reasons like loosening of the implant or infections after knee replacement, then what we do is revise the knee to a new one. So this is what we specialize in, and we have been doing revision knee replacements for the last 20 years. The results of knee revision replacement is not necessarily as good as a primary knee replacement, but the patient is extremely happy because we've got rid of the pain that they had before the surgery. So this is what is called a revision knee replacement, where you remove the old implant and you put in a new implant. Now we're going back to basics. So the joint problems can start from childhood to adulthood. So, I mean, I won't go into too much detail, but many young people I'm noticing these days are obese, unfit, and schools are also not providing good playgrounds. And we are noticing many young people in their teenage, during the school years, coming to me with knee pains and problems because they have not ventured out into the sun or played sports for a long time. So it's very important that young people venture out, play sports in the sunlight, which not only gives them vitamin D, but also gives them good, strong muscle and keeps their weight in control. So there's a huge problem of obesity in India. And unless the government recognizes this, the school recognizes this, the parents recognize this, the teachers recognize this, our kids are going to be in trouble at young age in the future. As we get older, if you happen to play sports, football is a high contact sport, and we see many people with ligament injuries and pain after, when they have an injury and come to me with knee pain. So they can have ACL injuries, ACL ligament tears, meniscal tears, and these kind of common issues which we repair regularly. They're also in young adults are getting arthritis because of what I've mentioned, obesity, but also if they have neglected knee injuries in their younger days. So at every age, there are many reasons for knee pain, but the most common seem to be lack of fitness, sporting injuries, road accidents, and arthritis in young people because of neglect of their lifestyle. And of course, in older age, we get osteoarthritis, which is common in all countries around the world. Thank you very much.